made, not when the veterans asked for the appointment. I don't need to
It
get
ought to
into
start
debate.
with the call.
Yes.
Thank you.
Senator Cramer.
Thank you, Chairman. Thank you to all of you for being here and for your testimony and for your service. So a couple of things come to mind. Well, one of the things with regard to Senator King's comments about shortage of workforce, that's a real problem. That's a problem in healthcare. It's a problem in manufacturing. It's a problem in everything. But it is particularly challenging in healthcare, which is why the CMS rule, the staffing rule, is so awful, because it literally provides less opportunity, because it runs the risk of shutting down healthcare providers simply because they don't have a 24-hour day, 7-day-a-week RN. And I would submit to you that access is not just about the quality of the care; it's about access, period. If the alternative is none. And so, while standards are important, I would also submit I don't share some of my friends' view that it shouldn't be competitive. I think the best way to improve care is competition. Whether it's a competition against a competition between the private sector and the public sector, or two private sectors or two public sector agencies. A little bit of competition is fine. I agree. I don't want to gut the VA's direct care system. There are unique things about the VA that I know several of my veterans. I have a veteran who would drive 300 miles to Fargo every day before he would see a local provider, particularly for counseling. All of that said, whether there are all kinds of barriers to community care. A lot of it is the bureaucracy itself. I mean, even in North Dakota, where we have quite a cooperative VA hospital in Fargo, we hear many stories of roadblocks being put up to community care. They check all the boxes except one, or they only check 99 out of the 100 boxes. Therefore, no. I just think we need to make it. I agree with what Senator Blackburn said. If we put the choice in the hands of the veteran, the market will determine where they go. The type of care they get will determine where they go. How long the wait is will determine where they go. So, a little bit about North Dakota. We have one VA center. It's in Fargo. That's the right on the Red River. I mean, literally right. It's on the shores of the Red River, which is the barrier, the border to Minnesota. That means if you're in Williston or Dickinson or Beach or you might be 400 miles away from the VA hospital. We have 8 SVACs, I think it is, and we have 37 critical access hospitals. Critical access care hospitals are there on purpose, and it has to do with access, right? And they're reimbursed by CMS in a particular formula. And we have veterans. And by the way, I think it's just a handful of those CBOCs are in the same community as a critical access hospital. What I'd like to see us do, and I've got a proposal to do this, and you'll be hearing more about it eventually, and if training's required, I'm all for it. But for many of these critical access hospitals, their margins are this thin. They're barely hanging in there. And 2 or 3 more patients or 5 more patients in the community might be what keeps that hospital open. And if it's 50 miles to the next hospital or 350 miles to the VA hospital, that critical access hospital might be the only provider that could save a veteran. I'd like to make this automatic. We can, no doubt, smart people can figure out the records thing. I don't know why it's taken so long if they can. Maybe I'll start with you, Mr. Lorraine. Is that plausible? Am I somewhere in the ballpark of a possible solution in a very, very rural place?
Yes, sir. I've been to Minot. I know how rural and out there it is.
That's one of our biggest cities.
But, one of the things that I spoke about was continuity of care.
Yeah.
And not only continuity of care, as a healthcare provider, I want the family there. I want the physical therapist nearby. I want the staff that does this. And we talk a lot about mental health and substance abuse, but it's really more than that. We're talking about access to healthcare. Right. So it's surgery. How many total knees are done in this location versus this location? So the answer is, we need to look at what's the best long-term outcome for a veteran in terms of getting their care. It may be the VA that's in their community, but it may be your local hospital that the family can be present, the physical therapist is there, the staff is invested, and it's all one. Thank you. Sorry.
I'd just rather have it easy rather than confusing and then likely a denial for community care. Thank you.
Senator Hassan, thank you, Chair.
Well, thank you, Chairman and Ranking Member Blumenthal.